cardiac cycle. And again, you've got to really try to, when you're going through this, this is where you really need to try to visualize what you know about the structures and what you know about the heart and how it beats, and think logically about what's going on here. The cardiac cycle, by definition, are the electrical and mechanical events that occur in one heartbeat. There are two phases, basically two general phases, and the atria and the ventricles go through them. There's a systolic phase, or systole, which is the contraction phase, and then there's diastole, which is relaxation phase. Now, when the heart begins, it's at rest here in the cardiac cycle. The heart is at rest. At this point, we're in what's known as mid to late diastole, in between beats. At this point in time, blood is returning to the right side of the heart through the vena cavae, entering into the right atrium. The atrioventricular valves are open, and the blood is filling in the right ventricle. Simultaneously, the blood is coming in through the pulmonary veins to the left side of the heart, through the left atrium, and through the bicuspid valve into the left ventricle. So this is occurring simultaneously. Both ventricles are filling. Then, once we get to a certain level, about 60 or 70% full, the SA node will fire. The SA node is the primary pacemaker of the heart, and the SA node will cause depolarization over the atrial myocardium. The atrial depolarization, that disruption of the membrane potential, which is excitatory, is seen as a P wave on the EKG. Then, shortly after that depolarization wave spreads, the atrial myocardium contracts. So we have atrial systole that occurs. The rest of the blood is then pumped into the ventricles, okay? And then what occurs is the atrial myocardium repolarizes and then goes into atrial diastole. It relaxes. Now, the AV node, at the time that the atria are relaxing, the AV node is going to send a signal down through the bundle branches, the right and left bundle branches, and out through the Purkinje fibers. A wave of depolarization will spread from the apex upward over the ventricular myocardium. So we get ventricular depolarization here. That electrical event is seen as QRS on the EKG. So after this depolarization wave spreads, then we end up with ventricular systole, or contraction of the ventricles. Now, as the pressure in the ventricles rises upward, it pushes the blood superiorly, causing the atrioventricular valves to slam shut. And that's heard as the S1 heart sound, or the lub sound, in auscultation, if you're listening to someone's heart. Now, as this pressure rises and the AV valves, they snap shut, a split second before the semilunar valves open, the aortic and the pulmonary semilunar valves open, at this point all the valves are shut, right before the semilunar valves open. This is called the isovolumetric contraction phase. At this point in time, no blood's coming into the ventricles, no blood's leaving, but it's just a split second. And the volume of blood in the ventricles at that time is all that the ventricles are going to hold for that heartbeat. Now, after the isovolumetric contraction phase, the blood is pushed into the aorta and pulmonary valves as the aorta and pulmonary artery as the semilunar valves are actually forced open. Then we have ventricular repolarization, which is seen as a T wave on the EKG. And then we have ventricular diastole. So the ventricles relax. When the ventricles relax, the pressure inside the ventricles, because it just expelled its blood, the blood pressure inside the ventricles is less than what's in the aorta and the pulmonary artery. So the blood wants to flow backwards from high pressure in the vessels to lower pressure in the ventricles. When it does that, in order to prevent this backflow, the semilunar valves snap shut and you hear your dup sound, the S2 heart sound. if for some reason a valve was insufficient, you would hear maybe more of instead of hearing a crisp lub dub, you might hear like a lush dub sound. Like if you had an AV valve, like the mitral valve or something like that, you wouldn't hear that crisp sound. But the semilunar valves, they snap shut, you hear the dub sound. The moment right before the AV valves open like a trap door, when all the valves are closed, this is the isovolumetric relaxation phase. No blood's moving in, no blood's leaving. It's the amount of blood, the least amount of blood that the ventricles would hold during that heartbeat. And then the AV valves finally open, and now blood is filling into the ventricles again. And now we're in early diastole. The heart is in between beats, and the whole thing begins again.